our start time of 3 o'clock, so I want to call the meeting to order and welcome everyone to the 2018 beginning of Lake County Community Advisory Council. It's kind of an exciting time. We don't have bad weather, so everyone should be happy, except for the ranchers that can't get water. So, welcome everyone. As we have done almost every meeting, but just, I don't think we have too many people that don't know each other, but let's start off by introducing ourselves, so that we all, because we don't have name badges, except for hospital employees. So Cece, would you start off?
I'm Cece Montgomery. I'm with the seniors and with just plain ordinary citizen.
Thank you.
I'm Alana Shamrock, and I'm with the Eastern Oregon Healthy Living Alliance.
John Adams, Eastern Oregon Healthy Living Alliance.
Paul McGinnis, Greater Oregon Behavioral Health and the Eastern Oregon Coordinated Care Organization.
Jamie Davis, Oregon State University Extension Service.
Jack Thompson, Lake County ESD Superintendent.
Okay, Hill, Lake County School District 7.
Janine Sims, Lake Health Clinic Care Coordinator Nurse.
Nam Dave, Quality Improvement Manager.
Susan Campbell, Lake Health Clinic Manager.
Lake District Hospital Executive Assistant to Charlie.
Brooke Kelleher, Food Corps.
I'm Charlie Twig, I'm the hospital CEO here. Who do we have on the phone? Anybody?
It's not. It's dialed in, so.
I thought Mary Ann Wren said she was calling in, but
Okay, well,
we'll see.
as soon as they call.
Mindy Bentley with Advantage Dental.
Oh,
There we go.
Then Mindy.
Thank you. Anyone else? Jimmy, you didn't introduce yourself.
Sorry, Jimmy Hawley on the
Thank you for being here.
examiner.
So, unfortunately, both our vendor and Christy Albertson are sick today. And they just called in just a little while ago and said, oh, we're not going to be able to be here. Two different locations, but you know. So somebody else joined us?
This is Alan Flood joining you.
Hi, Alan. Thank you for being
Good
here.
afternoon.
Afternoon. So, as a consequence, I'm not quite as prepared as I would like to have been, because usually our vendor is on top of that, but I'm going to wing it, and Nam is going to help me on the parts that I don't know. First off, I'd like to, has everyone had a chance to look at the minutes? I think they were all emailed out, or they were emailed to everyone. We have extra copies. If
We do.
haven't seen them. Does anybody need a copy?
They're two-sided, by the way.
Everyone have an agenda that needs an agenda?
Oh,
John, do you need?
there's a couple over here.
You need a couple? Okay. So while you're looking at that, probably our most important thing that we're going to work on, we'll come back to that, is we want to talk about the incentive measures and the grants that we have available. We need to apply for by January 31st. So our vendor and Christy and all of you that have been involved in these different applications, have any of you been involved in the applications?
Yeah.
Okay, so if you are more aware of the application than I am, what do we need?
So I need to be able to see the file explorer. I'm good now.
Sorry.
Yeah, you're okay. Okay.
We have 4 grant applications that we're going to talk about. 2 of the applications are as part of the program. They're not competitive. 2 are competitive. Is that correct?
One's not competitive, the LCAC dollars.
Just the LCAP dollars?
Yeah.
Okay.
And just a point of order, Mr. Chair,
Yes,
we need to approve the minutes,
we do.
and there's a couple additional agenda items that didn't make it.
Oh. What agenda items do we have that?
Well, elections. We're supposed to have our elections for chair and vice chair
Oh, that's right.
today. I don't know whether our vendor spoke with you or not. But
He did.
I directed him to do that. And then just a brief point on Measure 101.
Okay. Thanks. Any other additions? Oh, John?
Just a quick EOLA update.
Okay. Any other additions? I should have asked for that. Okay, so has everybody had a chance to look at the minutes? Let's start with those housekeeping items first. You had a chance to look at the minutes? If so, could I, yes,
I
Susan?
move that we approve the minutes as written.
Okay, do I have a second?
I'll second.
Thank you, Jim. It's been moved and seconded that we approve the minutes. All in favor, please signify by saying aye.
Aye.
Any opposed, same sign? None, minutes are approved. Thank you.
Best LCAC meetings in the region, by far.
Now, since we're the only one in the region, that works out really well.
Well, I'm in all 12 counties. They're just great.
Good. We'll pass that note along to Christie, who's been taking the minutes, so that's excellent.
We'll see how Jen does this time.
Big shoes.
I'm good at this, so it's all right.
Okay, so let's go right into elections. I have been serving as the chairperson for this committee since it was founded. And do we have nominations from the floor? Because I don't think we've had anybody express an interest in being the chairperson in the past. But so do we have any nominations or people that would like to serve in this capacity?
I nominate you for another year.
Do we have other nominations?
I'd like to amend the motion that nominations be closed. I'll second that.
There you go.
Thank you. Are there any other nominations? If not, it's been,
Yeah, we
the
did.
nominations have been closed. We have one candidate that I continue being the chairperson. All in favor, please signify by saying aye.
Aye.
Any opposed, same sign. Motion carries. Thank you.
Congratulations.
Thank you. Thank you.
Thank you.
Tough race.
I run out of things to do, so I'm not,
Yeah.
this really helps me a lot. I appreciate
Mhm.
that.
The other thing, just to confirm, that our vendor is your proxy to the Regional Community Advisory Council if you can't make it.
That's correct.
So
just so everyone
everybody
knows.
knows and it's reflected in the minutes.
Okay.
And the other person that goes to the regional CAC meeting is Commissioner Ken Kessler.
I haven't been, I don't think this last year, but prior meetings I have been, wherever I can. But our vendor is certainly capable of extending their interests on a regional-wide basis. So as these meetings come up, and Paul certainly keeps us aware of them, and John too, when Neola is involved. It's important that we have our representation and our votes as part of how the Eastern Oregon CCO spends money in our communities. So that's a positive thing. Jen, if you can send around to sign in, already sent that. Thank you. Excellent. So rather than talk about Measure 101 or
I can do that.
EOLA update, John, are you okay with that too? After we talk about the different grant programs. So, Jen,
Which one do you want first?
let's talk first about the first non-competitive grant request. So that is the
LCAC?
Yes, it's the
application,
LCAC.
Okay.
So Jamie, you were involved with that one, is that correct?
Yeah, I'm just pulling it up right now, too.
Okay. I know that Christie's done an enormous amount of work on them, and our vendor too, and others that have been involved. So and Nam, do you know a lot about them too?
Yes. Susan, our vendor, I and Christy were part of creating a bunch of these project timelines and these.
Okay. So, just to refresh everyone, one of the things that is happening in the CCO, and when the CCOs were first formed, there's been incentive measures every year for us to try and improve the health of the population. And some of those incentive measures have been to try and get lots of our recipients to get certain kinds of services. Whether it's colorectal cancer screening, or it's, and there's as you recall, there's been lots and lots of measures to try and encourage our population to be healthy or to get checked. There have been incentive dollars to encourage us, if we meet those requested, or I guess they're required, but they're incentive measures, that we get money in exchange for that. And it started off as, I think, about $500,000, $750,000. It's now up to $14–15 million in incentive dollars. So meeting those metrics has become ever increasingly important. So our incentives are to absolutely make sure that our people in Lake County are getting these services. A perfect example is, and John was involved when he was here as our Community Advisory Council CHIP coordinator, focusing on dental screening and dental, not shellacking, what do you call it?
Fluoride.
Fluoride sealant, thanks. I always feel like it's shellacking. It's the wrong term. So it's been a great shellacking. We started out, we got a bunch of little kids getting the sealants that we've not done as well. We're doing a little bit better. All of that. We have done sometimes better, sometimes worse, but there are dollars from the CCO to help us set up programs to meet, to get our community members to meet those metrics. So it's really, really important that when we take this money, that we have good results. It isn't just spending the money, and there's a lot of money involved. So in this grant this application, we are eligible to receive, what's the dollar amount, $35,000 if I recall?
35,000, yes.
35,396.
Say it again?
35,396.
$35,396. So that's a lot of money, folks. I don't know about you, but I'd spend it pretty quick. So what, maybe you could describe a little bit what we're looking at doing with this?
Sure. So with the LCAC grant, we are looking at working on 3 different measures. One of them being the developmental screening for kids under the age of 3. The other one is focusing on childhood obesity, and the third measure will be the prenatal postpartum care measure. Of the 3 that I mentioned, 2 of them are something that we are doing for the first time, especially the childhood obesity and the prenatal postpartum care measures is not something we have done in the past. So that's going to be a little bit more time consuming, and probably we'll find more challenges in implementing that project. But we have come up with a good plan on how we can sort of get some of this population to come in and see the providers and help them get the care that they need. So, Jen, if you scroll down, the first one we have mentioned is the...
That one?
Yes.
Okay.
The developmental screening is the first one that we are talking about. And our goal is to meet 40% on that. That was the 2017 goal for EOCCO. And we are waiting to get the goal for 2018, but we are hoping that we will be able to improve it to a 60%. That's going to be our goal for this year. And in order to... Jen?
Yeah. I'm going to say here. Since you do it.
Can I just make a point? Because this really illustrates it nice, and Christy was smart to go back and ask EOCCO, to help get some of the old data. Notice on the right-hand side where it says targets, they just keep increasing. And that's part of, not only is the money increasing, like Charlie said, but the difficulty. So NOM is probably right, it's gonna be about 60.3%. Usually they go up about 3.
So the Lake County's goal will be to reach a 60% this year. And in order to encourage parents to bring their kids in for these screenings, we have come up with a plan of giving diapers to the parents when they come in. And because we have a good deal with the company that gives us diapers, we will be able to give diapers at every visit. So for those who don't know, these developmental screenings can be done multiple times in the first year. So it is a pretty hefty schedule. So they see the kids at 2 weeks, 2 months, 4 months, 6 months, 9 months, and 12 months. So that's probably 6 visits in the first year. And the ASQ, that's the tool that we are supposed to use, are also available for all these 6 times, but we will be encouraging the parents to come in and get these screenings done and provide them with a 20-packet diaper for every time they come in. And that has been laid out here in the grant. Sorry, all the way at the end, sorry.
Christy's done a lot of writing.
Yes.
This is a big project.
Yeah. So as
But
you can
it's critical for our community.
And as a part of the developmental screening, another additional thing that we have added is that we want to include hearing screenings or follow-up hearing screenings for infants. So when the kids are discharged from the hospital, they are tested on how their hearing is. If they do not pass, then they are referred to go to public health to get a follow-up hearing. But we are trying to work with public health on getting these follow-up results on one place, so the parents will find it easier to follow up with an audiologist if there is a need for that. Do you want to add anything, Susan, to this developmental screening?
I think part of the, we formed a team of clinical staff to kind of say, we haven't really done a stellar job at doing this. What do you think we can do? You work hands-on with the providers. How do you think it's going to be successful in your world? And so we've actually created some new templates that are going to make it easier for the providers to be able to hit all of the necessary points. And then we've also kind of devised a timeline for, like, the parents will come in a little bit earlier. We're going to tell them you're scheduled 30 minutes ahead of when you'll actually see the provider, so that you have time to complete your developmental screening survey, and have staff available to help them through that process if that's necessary, and then time for that MAs for that. So that the provider, once they get in the room with the provider, it's like, okay, I can have my questions answered, we can go over any areas that may need attention or any of that in those early visits. The hearing screening, getting that follow-up is really imperative to that infant, being able to reach their other developmental targets, because if they can't hear, that's one of those things that is really can set them back. So we're hoping to have much better success this year.
Keep in mind also that while it may sound like this is mostly Lake Health Clinic, it also includes North Lake, and it also includes Warner Mountain Clinic. So you're hearing just from one clinic, but there's actually every location. The incentive diapers are available at all the locations. So we're trying to be as county-wide focused as we can. So that's important, because we're talking about the entire population. We're not just talking about those people that come to one clinic or another.
Dayla was a part of the meetings when we were putting these plans together, so she has been a part of that, and as a part of the grant, we are saying that the diaper and the gas cards will be taken to Christmas Valley so that the population there can also take the advantage of this initiative. So
Isn't that hearing test a new law?
I believe it is.
Or it was a couple of sessions ago, maybe?
I think it has been in place for more than a year now, because we started, when it became the law, we started doing them in the hospital more consistently too, so we have been doing it for more than a year now.
Okay.
One of the things we're also looking to do is to make the testing equipment available in multiple locations. We have not always had that in the county. So many times if a mom delivers, they may not realize the importance of coming back for subsequent visits for their child. And sometimes their child's developmental skills then are impaired because they're not getting those regular tests, especially hearing. So they may be losing out. So we're looking to have that testing equipment available in multiple locations.
So the other measure that we had mentioned in this was the timeliness of prenatal and postpartum care. And as a part of this measure, again, one of the big things we are going to do with this is get the prenatal care, target the patients for their prenatal care. That is the population that does not come in as frequently as they should. So in order to capture their attention, we are going to collaborate with the public health and probably with just putting the ads out that they need to get their prenatal care, and there will be gift card incentives available for the parents at their prenatal appointments. But one thing to keep in mind is that since we do not have very good baseline data at this time for the prenatal postpartum care in our county, and we will be working on gathering that during probably the first 3 months so that we know which site is doing good versus the other, so we can work on improving that.
The problem there, Nam, is that it's a bundled payment. So only after the delivery is done is the services coded, and by that time, it's way too late to go back and get somebody in for the first trimester. So, I think the upfront stuff with anybody going to public health for testing, or that's where you'll at least get people into the system, and then you can track them, knowing what's going on. But we're never going to get reports from somewhere else until after the baby is born.
Right, and we have included public health in the discussion and told them how, and we are working on creating a process so that public health can refer anybody who tests positive to whichever clinic, and if they do not have any provider, probably even establish care with one of the clinics in the area.
Yeah, one of the things that we discussed with public health was upon getting a positive screening was making both clinics available to, which providers are available. They can call us and schedule that first appointment right away. So it's already on the books. We're going to remind them. And also, if they aren't paneled to the provider that they want to use, we have the tools to help them change that. So that if they're assigned to Lake Health, but they want to see Dr. Graham, we're happy to help facilitate them being able to make that change so that they're comfortable with that prenatal care.
And the third measure that we have mentioned in the LCAC grant was the weight assessment and counseling for nutrition and physical activity of kids and adolescents. And a part of this is already being done. The weight assessment is done for everybody when they walk into the clinic. So that piece is being done, but what we need to capture better is how the counseling is being done on nutrition and physical activity. And in order to meet and sort of get more exposure to that population, we will be collaborating with, I think OSU Extension has a triathlon training program. And so that is one of the places when they do the triathlon training, the adolescents and the kids will be there. So that will be a good time to probably have a table and get appointments for them. And the other one is also during the summer food program that we would have. We would like to distribute more education material and brochures on advising the parents to bring the kids in for their annual physical or something along those lines. So we are working on creating a template, and Dela has agreed that she will be working with us. I am not 100% sure on what's happening with the Christmas value on this, but our vendor might have better insight on that.
Alan's on the phone.
Oh.
Alan? He was. So with kids 3 to 17 though, I understand the weight assessment. It's just as important as their height.
Right, weight and height is done on every
Okay.
at least our.
Good, because we found in a lot of cases, it's just weight and.
No, we measure the little guys.
It is an issue, isn't it?
Oh, well, that's how you calculate
Yeah,
the
calculate the
BMI,
BMI,
where they are in their growth chart. The other thing that I haven't figured out yet, Norm, is whether or not a community health worker is eligible to be doing the counseling.
Okay.
Who determines that?
Still trying to figure it out, but it would probably be, you know, the Oregon Health Authority has the codes that must go in, but who can provide it is a different story.
When will we know that, do you think?
I'm checking on it.
Okay.
So any questions on any of these measures, or if you want more information on how we plan to put this project together in the timeline, I'll be happy to share more information if anybody has any questions.
What we would like to have is, if you all agree with this, I'd like to have you vote and accept this plan for how we're going to apply for, and then if granted this money, which we anticipate we will be, that we would spend it in this fashion.
I so move that we accept the application as presented for the LCAC community benefit grant dollars.
Okay. Do we have a second?
I'll second.
It's been moved and seconded. Is there any other discussion? If not, all in favor, please signify by saying aye.
Aye.
Any opposed, same sign. Thank you. This is exciting that we're working on this. Now we want to go to the next two applications that we have. And these are competitive. So what that means is, the way and Paul, correct me if I'm stating this incorrectly, what the CCO board decided was, rather than set a certain dollar amount or a certain amount that would go to any individual county, they said anybody that's got a good program, and you may have 5 programs. If it's a good program, compare it to the other counties. We'll pick, if they're all 5 in this county, we'll pick them. So it is going to be, there's no guarantee we'll get this money, but it'll be compared to what anybody else submits. So a lot of effort and thought has gone into this. I hope many of you have been involved. If not, those that have been working on it have spent a lot of time thinking about it. So the first one, this is the colorectal screening program. Now, do you want to say anything, or?
Sure. Susan, do you want to talk?
Go ahead.
Okay. So the funds available for this grant is up to $25,000, but I don't think we are requesting for the entire amount, because based on our calculations and what we spent this year, we might not need all of that. But looking at this target and what we have done so far, Lake County rate was 39.5% through November, and the goal for this last year was 43%. But we are hoping that once the December numbers come through, we will meet that measure. Do you have the December numbers, Paul?
It'll come out on the 15th, which I think is either Monday or Tuesday.
Next week, okay.
Our numbers
Our
show
nails.
one thing, but remember, what the CCO receives and what they claim is accurate is a different thing. So we'll find out more on that. The dollar amount that we're requesting is $15,430, not the full $25,000 on this project.
And as you can see, we have consistently improved our rate, and this big jump in 2017 has been because of the colorectal cancer screening grant that we received in 2017. And as a part of this grant, what we do is we send out these colorectal cancer screening packets to the EOCCO members to their home. They can do the test at home and send it back. And then we provide them with a $20 gift certificate for completing the test, along with the test result if it is negative. And if the test results are positive, then an appointment is made with their primary care provider. And it has been really great this year, and between Warner Mountain and Lake Health Clinic, our response rate was more than 50% on those packets. So it has worked really great, and we are hoping to do the same again this year.
Just as long as those materials emphasize that that test is required annually.
Yes.
Because one of the scares is, okay, I'm good, right?
Mm-hmm.
I didn't hear back from them, and then you don't think that you have to do it again, but that is an annual test.
Correct. Mm-hmm.
And I'm just curious, the other clinics that participated in the opt-in with you last year, how did they do? Did they get 50%? I don't think so.
So I know of Warner Mountain and us, I don't know what Christmas Valley's response rate was. I just
Well,
know
I meant
because
any of the other ones around the region that did the opt-in last year.
I'm
Okay.
not sure.
I think 50% is pretty good.
Is that right?
Yeah.
What should be an expected response rate on something like this, Paul?
Yeah, I was thinking it's 35, 40%, something like that.
Even with economic incentives?
Yeah, you remember when Wheeler gave out $50 and they were still at that level, at 30%. And by the way, for people who want, Wheeler had a nice idea. It said, if you don't want the money, you can donate it to the school.
Really?
On the incentives, yeah.
That's a great idea. Maybe we ought to put that into our,
You know,
our
because it
offering.
wasn't what, some people weren't motivated by that little piece of thing, so that they could, you know, invest in it.
Well, if we were to do that, what would we want people to make any donation of that amount? Would that go to the, would it be just the general fund of the school?
I would really need to discuss which account is most applicable with my principals and business manager, but yeah, it could be done, yes.
If you could look into that, that
Yeah,
would give,
I can email you that information, Charlie, so,
that would be great.
yeah.
Because that's a great opportunity if people are not motivated by the dollars, but still want to have it done.
Yeah.
And give it to a very valuable purpose. So that's a great suggestion. Thank you.
Susan, do you want to add anything?
Anything else we should choose?
We had great response rate. We are implementing a few things, to help encourage even a better response rate next year. We've implemented some additional follow-up pieces from our MA. So working with the vendor was great. We had, they took care of a lot of things for us, which was awesome. But it's always nice to get that phone call from that voice that you know that works with your doctor that you see every time you come in. And so we're going to have a little bit better follow-up from the local staff next year, just to kind of, help beef that up a little bit.
Did we find from the senior fair that had a good response rate?
We didn't have a senior fair last year. This is the plan for this year, since we have more months. Like in 2017, we sort of rushed into implementing the project. We didn't have a lot of time to plan. So this year, since we have more time, we plan that if there is a senior fair held in April, we will promote this incentive measure during that time, and also during the hospital fair.
Okay. Good.
Paul just reminded me of something. So the American Cancer Society, they loan out, so they have a giant inflatable colon that they loan out for free. So
Okay.
I can send you the contact information if you guys are interested.
I was thinking that's what model colon was. Unless you
Yes.
give a star for somebody who can have like no polyps. That's a
Yeah, we
polyp.
talked about buying a colon, but no, they're actual colon models, like tabletop models.
Oh, okay.
So has the blow-up colon been pretty well received in other communities?
Oh, all over. Yeah, and several of the cats have bought them.
Is that right?
Yeah.
Very cool.
They
We
make-
looked
If
at
you
them a
go to the
couple of years
Town
ago.
Fair, you gotta walk through a colon to get to the gate.
We looked at them.
That's what we were talking about, yeah.
2 years ago, we looked at them, Charlie, with like health medical supplies, but we couldn't find anywhere to rent them, and they were astronomical to purchase. It weren't within that budget, so it was something we were like, oh, maybe we'll look at it later to draw people in, so.
John, we'll look forward to hearing from you on that. Because that, if that could help in encouraging people to be aware of what happens if they don't take care of their colon,
Good
as fun as
icebreaker.
it sounds.
Yeah.
It's usually the little kids that see it and don't know what it is and drag mom or dad or grandma or grandpa over to it to be like, oh, I want to go see what it is.
Is it a healthy colon?
It's got
No,
the
it's got
different
some
stages
polyps
when
and
you walk
you
through
can
it.
take a selfie with it. That's what they did today.
Selfie?
A selfie with a polyp.
I'll make a geofilter.
Jamie's a pro at the geo filters.
Geo filter?
Yes, on Snapchat, I'm sure you have Snapchat.
need to request translation service.
Well,
We spent too much
we
time.
can learn more about this. Okay. So that's our first application. The next application that we are considering submitting is,
This will be the adolescent well care visits
Talked about.
or the teen health fair. And so again, last year's teen health fair was very successful and we would like to do that teen health fair again this year. A couple of things that we might change probably would be the booths that we had available and have a better way for the kids to flow through all the booths and have more activities for them to do while they are there. And again, we would like to do the fair probably around the same time because we wanted to do it after the parent-teacher conference because that helped having parents available to sign kids up for their appointments.
Last time we met, we talked November 7th, but I'm developing the school district calendars right now, so not definitive as far as when that's going to be, but probably sometime within the time frame November 7th to November 14th. In that time frame.
since this is a competitive, since both of these are competitive grants, we may or may not get the money, or may not get the full amount. It's hard to know. If you scroll down, you'll see that our request is $25,210. It's a lot of money, but it went well. I'm told that the blender bike was used a fair amount. And
that was free, we borrowed it from the Klamath Extension, so.
oh, did you?
Things like that.
You don't have one yourself?
We don't, we just borrow it from our colleagues in
Okay.
Clem. It would be great to have one in Lake County, because it's a beast to
Sherman
transport.
County has. I don't know how many people?
I know.
And I'm told that the hooded sweatshirts were really popular and that the kids are wearing to school all the time. Is that correct?
That's correct.
So that's a great sign to have the Outback Strong logo and helps kids to think about those things. So we want to keep pursuing this, correct?
Yes, and in last year, we were able to do only one teen health fair that was here. But this year, in 2018, we are planning to do one in North Lake as well. So there are talks going on with Christmas Valley on trying to have a fair there. So there'll be like 2 fairs, one here and one up north.
So if you don't get the money for this, could we still have the health fairs and just maybe not have all the gimmicks along with it? Still be able to do some sort of event?
We could, but I think incentives was a big reason why so many kids showed up. And another thing with that was that the incentives got the kids to come to the clinic and finish the visit with the providers. And I don't know if that would be done or that would motivate the kids to come if they didn't have an incentive in here.
I think we gave away a bicycle or a couple bikes and some snowboards and some passes to the rock wall or the ski hill. I'm told that if there isn't snow, that they'll extend that to next year, because it's been kind of rough.
No, but let me ask a question of Mindy. Mindy, are you still with us?
I am.
Hey, yesterday or Tuesday in Harney, they were talking about the Adolescent Well Clinic, and I can't seem to find it, but have you heard that they want dental sealants to be part of that? Have you guys been getting approached?
Not that I'm aware of. I would have to check with Mary Ann, but I don't have anything on that.
Okay, well, any of these Adolescent Well Clinic events now are supposed to have dental sealants as part of it. And it sounded like it was mandatory, and I told people, well, just put the application in and work on it, but those are 2 different incentive measures that are being forced together, so I don't know.
Harney is doing with their rural elementary schools, they're doing a health fair day in the fall, and they're gonna have dental sealants at that.
Yeah, but
But
that's
I don't
not
know
part of
if
the
they're doing
adolescent
the
well
countywide.
visits, not part of that. And then, I don't know what we're doing to try to get 18 to 21-year-olds, but you're supposed to try to address that somehow.
18 to 20 for dental sealants?
No, for adolescent well care.
Charlie, they're adolescent until 21 years of age. They're considered adolescent, so we have to capture 18 to 21 years old.
we haven't, the CCO as a whole hasn't been getting those in, and so they're just encouraging some kind of outreach target for that population, and not
We-
necessarily the
We
same
did
event.
talk about that, like what we wanted to do was probably have some hooded sweatshirts available for the 18 to 21-year-old, and for them, the bigger prize could probably be an iPad or a computer that they can use for schoolwork or college. And the thing was just to reach out to KCC and,
Put flyers.
yeah, just flyers up and.
We even talked about having a table like at their back to school night, you know, because they have like, registration and some of those different events. So we talked about having a table with representatives there to schedule as
Just
well.
making sure that you address those. It doesn't have to be a detailed plan, because the bulk of them are younger, but the other thing, Susan, that was pointed out by somebody, some of your health records, the electronic health records, when you do an exam on an 18-year-old, it's coded as an adult.
Oh,
So
we'll
you
check our
have
templates
special-
to make sure
you
that we have the right
a special code
coding.
for adolescent well clinic for any
Right.
adolescents, but as soon as you turn 18, the record changes, and, you know, it's gonna suggest that it's an adult physical exam, not an adolescent well clinic.
Yeah, we'll verify our template to make sure that it's, we rebuilt them all right before the teen health fair, so they should be good, but that's a good point. We'll definitely follow up on that.
So that means that the young at heart, that are over 18, or over 21 can apply for the free computer, is that what you're saying? Some people like us that might. Just kidding.
Have you thought about approaching like local businesses to try to get sponsorship or donated goods or money for this in case we don't get grant dollars?
There has not been a discussion yet probably, but I think if we don't get the grant dollars, all of those innovative ideas would be helpful on how to keep it going.
We did talk a little bit about sustainability and how we might be able to do, you know, similar things to that without hitting our local vendors too hard, because they get hit up for quite a bit of stuff, but we did talk a little bit about sustainability.
Well, let me just say this one. I know that it has to be addressed in every opt-in and every LCAC application, but the fact is that these are annual. You know, I mean, it's not like you turn 37 months and then you're not eligible for the developmental screens anymore, or, I mean, between colon cancer and adolescent well clinic, I think there's gonna be money for this stuff every year. I really do. I don't see how we back off on it, because it just doesn't stop.
But some of this, hopefully, we will help establish better health patterns, and that people won't need incentives to take care of themselves. So that's still part of the goal, is to get it started and then have it sustain itself by people caring about it. So, thank you. And so we're asking for $25,210 in this application. The next application.
Were there any provider dollars there? Or are you assuming that you're gonna just take the bill for the services during the
Yeah, I
bid?
think we're just gonna in kind.
Yeah, we did not have any provider dollars in here
Okay.
at this time. And I think the third grant we had was the.
Diabetes.
So diabetes, hypertension is sort of a new measure for us in the sense of reaching out to the patients. We do take care of the patients that come to the clinic, but this grant will help us be proactive in reaching out to the patients with this chronic condition of diabetes and hypertension. And a lot of the grant dollars we are asking is to help us support the classes with probably some books and some other material, education material for the patients attending it. The other piece was to get some people from the clinics trained so that they can teach these classes. And then a little bit of the dollars will also go in running some support groups if some of the patients are interested in meeting after the classes end. Ginny, do you want to add anything on this? Do you know anything about this?
No, just that we're looking towards having a support group in the county.
Okay.
Would that predominantly be in Lakeview, or are we going to
Yes.
try and shoot for Paisley and Christmas Valley, or first years?
First year will probably be in Lake County, or Lakeview only.
Okay. So if we find somebody who is interested in teaching classes or holding groups in North Lake or Paisley or other outlying areas, that we didn't actually put dollars in here in case that were to happen, because as we start this process of generating interest, we might find someone who becomes a zealot and wants to teach and help promote diabetic education.
Make sure the clinic workflow process on getting people who are hypertensive and diabetic, especially those that are uncontrolled, is well defined in the grant, because the Ortberg people are going to be looking at, yeah, we know that those classes exist, it's how do you get people to go to. So what is the actual
process? And we are using Arcadia Analytics as a registry on identifying those patients and then creating materials to send it, but you're right, we'll make
So
sure.
essentially, you've picked Living Well as your quality improvement strategy for that, but it really, if people go to Living Well, it works well. It's getting them to go. So that process that happens in the clinic about talking to that patient, that needs to be pretty well described in the application, I would guess.
Okay.
Good point on that. We're asking for $30,000 on this application. So it's a lot of money, but it's a very significant program.
We talked a while ago about the Veggie RX. Could that be something incentive-wise? We were talking about that.
What's the Veggie RX? Can you explain it?
So it's something that they did, I don't even, I'm still
Gorge
new to
grown.
Oregon, but it
Gorge
was
grown.
okay.
This is good, yeah. You want me to handle it?
Sure.
Because I have the right one. Gillum and Sherman and a large chunk of the Harney County dollars, they're all going together and running their own Veggie RX program, which is a process that gives people access to fresh fruits and vegetables through a health security screen. It's 2-question screen, and if people answer no to either one of them, they're eligible for a packet of $30 worth of $2 coupons. And they can go to the vendors collect them up, they send it to Gorge Grown. In this case, it's going to be, they're going to send it to Gobi, and Gobi pays the vendor back.
How does this work with the WIC program, where they have similar?
It's in conjunction with.
It's in conjunction, so it's a
Yeah.
a linked program?
Harney, it's a good point that you made there because of hypertension and diabetes, because there's not enough money to have all of the EOCCO people be screened for this and then have, you know, each of them eligible once a month for a $30 fruits and vegetables. So I think they're going to have to tighten it down to diabetics and hypertensives and probably pregnant women supplementing with. But in Gillum and Sherman County, any of their members are eligible. And it worked well in Sherman. We wanted Gorge Grown to expand and go out in Eastern Oregon, but their board of directors said, no, we're 5 counties in Wasco, Hood River, Sherman, and a couple in Washington, and they're not going any further. So we need to administratively create that system.
They have access to a lot of row crops, though, that we don't have here, Lake County.
Same with Harney. Sherman and Gillum aren't growing much but wheat.
So where are they importing all their vegetables from?
The stores get them.
That'd be good for everyone.
Oh, yeah.
Right. So if we were ever doing that here, we'd work with any of the markets in Paisley, the smaller ones in particular, to encourage them. And, you know, it's working well.
Okay. That's something we might want to think about next year.
$12.
And it may be EOCCO wide next year.
Is that right?
I'm thinking we're going to get asked to be doing something similar by the Oregon Health Authority, just as a CCO. So you're good right now. We're just piloting for future understanding.
So we have 3 applications. We have the application for dealing with diabetes, we have the program for adolescents, and the colorectal cancer screening program. Does anyone have any additional questions about these applications? There's a lot of time and effort been put on this, and estimating all your thoughts about not having provider time. But again, we were anticipating the providers would be paid for their time by seeing the patients. Are there any other suggestions or comments that we ought to be thinking about? Because we still have a little bit of time, we've got about 15 days before we have the deadline. If we want to change any of this, we'd be certainly happy to send out the full application if anybody wants to look and review, read, or Jamie, did you?
Oh, no, Jen sent them out.
I did, we sent them out because we weren't sure who all was gonna call in,
Okay.
so we sent them prior to the meeting.
Okay, so everyone's had a chance. If you haven't had a chance to review it completely, we do have roughly 10 days before we have to submit them to be on time. Can I get a motion to accept them as they are, or do
I
I?
don't think you need one, Charlie. You only needed one for the LCAC dollars, because the actual applicant is not the LCAC for any of the other ones. It's the hospital or clinic or someone else. So this group only needs to approve whatever we're doing with the 35,900 and something. Because I mean, only clinics are even eligible for the population health one. That's all. That's the only people who can apply.
Okay.
I was going to say, would a documentation of support maybe be a positive thing to have?
So
Yeah, you should use your letterhead and write your own letter of support from the LCAC to these. That's a great idea.
Well, Christy is providing,
Okay.
she's lining us out.
But then the LCAC would need to say, yes, we endorse it, and that way the letter of support's in.
So here's what I
thank
would like
you.
to ask is if someone would make a motion to endorse these applications. Doesn't mean that we're going to get them, but in showing support that you believe these applications make sense. I'd be happy to entertain a motion.
So moved.
Second. And seconded. It's been moved and seconded that the Lake County Community Advisory Council support these applications to the EOCCO for the close to $70,000 in grant money. All in favor, please signify by saying aye.
Aye.
Any opposed? Thank you. And if you do have any suggestions, please don't hesitate to get a hold of Christy, because she will be completing these and I'll sign them and we'll get them sent. Thank you very much. Thank you. Paul, would you like to talk a little bit about Measure 101?
We'll do so just briefly, answer questions if we can. For those of you who are registered voters, you should have gotten a ballot in your mail this year or this past week. The only issue on the ballot is something called Measure 101. The Oregon Legislature at the last year, let me just back up. Only two types of dollars can be used to match federal dollars for the Medicaid program. One is a general fund dollar. A general fund dollar is what you see right off your paycheck when it says State of Oregon. So if the State of Oregon commits $1 to that program, depending on the category of the person, but generally, you know, it's like a $3.50 to $6 match for that $1. The other type of dollar that you can use is a health tax dollar in order to be able to leverage the federal funding. So in a sense, you couldn't put a gas tax on people and then use that to leverage Medicaid dollars. So health insurers in Oregon, the coordinated care organizations, and eligible hospitals. So these would be nonprofit hospitals, district hospitals, or districts that run hospitals can't contribute to that, have agreed to tax themselves at 1.7%. And you know, that's what the legislature passed. It's been referred back to the voters in a referendum from a group of people who feel that that's a sales tax to everybody here as they consume services. So what it covers essentially, if yes continues, then the Medicaid population as we know it right now will mainly be maintained. If a no vote happens, unless the legislature finds the money to replace that tax, then it's likely that the people who joined Medicaid since 2013, the expansion population, about a third of the members, about 600 in Lake County out of 1,800, will probably go back to being what they were before, which is people who are working full-time but don't have insurance. So I just encourage you to look at the materials and vote, because the turnout's going to be good.
So just so that you know, as a district, we cannot take a position for or against, because it is a public decision. I can tell you that the Health District Board of Directors at its recent board meeting endorsed the Measure 101. So saying yes to Measure 101. But I am not taking a position either way. I'm just telling you what the board.
And hopefully I just told you what was at, what the situation is. You're encouraged to vote.
When I have been asked, what impact would it have to Lake Health District if Measure 101 does not pass? There are two things that would have to happen. If it doesn't pass the legislature in February, because it goes directly into a short session for about 30 days, they have to try and figure out how to come up with an additional way of paying for the Medicaid population services. Inasmuch as in the state of Oregon, they need to have, I believe it is 3/4 of all the legislators to approve a tax, which is to raise money to pay for this. The likelihood that that would happen is probably, well, it's hard to predict, but not terribly likely, which means, as Paul said, that there would be people within Lake County that would not have coverage. And so the impact to the health district is that our bad debt and charity care would go up. We would continue to deliver care to those people in our community that need care, whether they have the ability to pay or not. So we're not going to refuse to treat people, but there would not be state funds to pay for.
And there's a historical track record for all hospitals in Oregon and what their charity care was, if you care to look it up. And then, you know, it went down significantly once people became insured. But the other part that people forget is, look at what we discussed at the beginning of this meeting for 45 minutes. It was, how do we outreach people to get preventive services and screenings? It doesn't talk about them being sick. It talks about getting ahead of issues, and that's not going to happen, you know, if, you know, in charity and bad debt. That outreach is not likely to occur. You're going to wait for somebody to show up at the emergency department or really sick at a clinic.
It really goes against what we are working on in this group, which is to try, as Paul said, to reach out to people before they're sick. The hospital is a perfect place to go when you are sick. But we want to catch people before they're sick so that they don't need to use our service. Because we're expensive. Coming to a hospital is very expensive. And we can't afford that as taxpayers. So, any questions on Measure 101? As Paul said, we do encourage everyone to vote. And you should have gotten a ballot in the mail. And should have got information. Thank you, Paul. Would you like to give us an EOLA update?
Yeah, I just want to give a quick reminder that we have some mental health first aid trainings coming up in Lake County. So next week, the 17th and the 19th, we are holding 2 trainings for our law enforcement. So that's, we invited all city, county, state agencies, as well as emergency services, so dispatchers, first responders. I don't know that they're going to send anyone, but I even reached out to the prison and said, hey, if you have anyone that needs to come to the training. So we're going to have 2 trainings for that next week. I'm really excited about that. And then...
Adults or children?
Adults.
Okay.
It's the adult mental health first aid. So that's going to be the public safety module. And then February 12th and 13th, we are holding, it'll be one training just split into 2 days in the morning at the senior center, and that's going to be the older adults and those with later life issues adult module. So that focuses just a little bit more on the Alzheimer's, the dementia, the later in life issues that can happen. That one we are primarily targeting clergy and our ministers association, but however, it's open to anyone working with older adults. So senior center staff, home care workers. I have flyers on that with some info if anyone wants to take that. I know the senior center said they would hang one up this morning. It's got a little bit of info on there. And then we're also working with the schools. I've been talking to Lonnie and Rusty, trying to figure out, we were hoping to get a training in before the end of this school year, but just logistically with them needing subs and everything.
We had a discussion this week, and it's
Yeah.
probably going to have to happen, probably in conjunction with the service next fall.
Yeah, and that would be really nice and in service because then we'd be able to get all staff or close to all staff trained without needing to worry about getting subs and them missing classroom time and all that. And that would be the youth mental health first aid, and hopefully by then I'll be trained in youth and I'll be able to teach that also.
I went through it about 4 months ago for adults, and it's really a good, it's a good use of one day. It really is.
Good. Anything else you'd like to add?
That's all I got, unless anyone has any questions.
So what I'd like to do now, thank you for that, is ask everyone that has something from their organization they'd like to talk about. Something you can tell us about what's going on or something that is important that you're working on. We'll start with you, Brooke.
Sure. Well, I just finished up a training that I was doing with the food service staff at the elementary schools. It was called the Smarter Lunchrooms Training that I was able to connect with the Klamath Extension Office through Jamie. And so hopefully for the rest of the year, we're going to be working on trying to implement some changes into the cafeteria to encourage kids to eat healthier foods, to choose healthier foods and actually eat them instead of throw them away. So I'm really excited about that. It was really good connections that I made this whole thing.
Ladies, anything you'd like to add?
No, not at this time.
Okay.
Thank you.
Susan, anything you'd like to bring up?
We have been working in the clinics a lot on, the last few weeks, on these grant proposals and how we can really come up with some great ways to help engage our patients and different methods that is going to, empower them to want to make the change from, looking at putting fire out versus coming in and staying healthy and those sorts of things, because it's a big education piece. So we've been very active in trying to figure out how we can engage the patients and incentivize them to want to do that and to understand why I don't just come to the doctor when I'm sick. So it's kind of going to be a whole culture change for us. So we're starting with us.
So just a point for Susan, on Wednesday, the Eastern Oregon Coordinated Care Organization's Clinical Advisory Panel will be reviewing and approving the methodology for the quality pool payments.
Okay.
So you remember the letter we talked about where there was a gap because out of that 10, 15 million that Charlie's talking about, several million goes right to clinics if they meet the measure, but if they don't, they get less. And so you haven't signed your contract with the OCCO yet because that's going to have to be part of it. So you'll look for something very soon.
Thank you for that musical interlude. We appreciate that. Tom, anything you'd like to bring up?
No.
Okay.
Francine Winters and I just started the second group of classes on chronic pain self-management, and the first group we finished about 3 weeks ago. It was very successful, so we're excited to start the second series, and we're having it in the afternoon this time to appeal to people that can't get out at night.
Excellent. Excellent.
And it's at the senior center.
It's at the senior center? Marvelous. So we'll let people know more about that in different ways?
Sure, well, yeah, it's posted all over the place.
Do we know if any of the people with chronic lower back pain are using the alternatives that we're willing to pay for, the acupuncture, the chiropractic, those services, the alternative care providers? Do we know?
One of the
Do you get a
challenges
sense
we
for-
face in Lake County is we don't have an acupuncturist.
Oh, I thought there was, I know there's one in the north.
visits
once a
month to the senior center.
Oh, I stand corrected.
Whether they're contracted with us, I don't know, but I'm just curious whether the uptick on, the
Alternatives?
payments for those alternatives is doing anything.
That's something we want to look for, track down. Thank you, Janine. Will, how are things at the school?
Gosh, nothing to report today. I'm going to report on the teen fair the last time we met and how great that went, and really, that's all I have. So.
Marvelous. Jack, same thing?
Just to let people know that our Youth Mentor Program is having their Western Extravaganza February 24th at the Elks Club. And so there'll be dinner there, and tickets will be sold coming up here real soon. I think they're even printed, so we just need to get them, they'll be sold here. I believe it's $15 for the dinner. So anyway, that's coming up. So please purchase a ticket and support the Youth Mentor Program. Chicken and beef. So one or the other.
You could have guessed that.
Not saying it's tri-tip, but this is no lobster. No lobster, no lobster, and no fresh salmon or from the river. Right? No Goose Lake salmon.
That's probably a good thing.
Yeah.
Jamie, anything?
Oh, sure. This time of year is a lot of reporting and grant writing, very similar to what many people have been working on here in the room. And I think one of the items about that we visited briefly about was the triathlon training season or training program that is part of our LCAC grant. And the goal of that is with these funds is Home and Health Hospice puts on a triathlon, which is at the end of the summer, and part of those grant dollars will go to support systematic physical activity programs throughout the summer, once a week, that encourage youth. It's targeting aged youth, basically 5 through 18, but we're really thinking it'll be those elementary age youth to learn different types of things to support their participation in the triathlon. And what we know is many of the parents also complete the triathlon, so as a family unit, become more physically active throughout the summer. So I'm hoping all that funding falls together, and we'll be doing a lot of planning to make that happen for the Lakeview community.
We obviously facilitate a whole bunch of things going on, the Living Well class, which, by the way, they've had incredible participation this round and the last round. I think the last time that we had one of the classes from Klamath, we had about maybe 6 participants, and you guys had, what, 14? So it's great, and we have a lot of people coming in asking about it on a rate. And it actually, I think it helps promote it a little bit more that it's in the afternoon this time, because they see it. We have lunch Monday, Wednesday, and Friday, so it's on Monday afternoon. And they're like, what's going on? What's back there? And then when we tell them what it is, oh, my doctor suggested, so it is getting around, and it is getting more people involved. And I noticed this time a lot of people actually that are attending that have asked us in the past and kind of said, oh, I should probably, do that, and haven't. So it's encouraging that they're doing it. And of course, we facilitate the location for the Strong People program, and that is growing tremendously. They're going to outgrow the dining room.
Yeah.
Is that right?
Yeah.
We need a building.
Yeah.
That's marvelous.
Yeah. We could have 2 classes going on at once, one in the conference room and one in the dining room. They're really, it's getting to be bigger. We're going to have to start moving tables completely out, kind of thing.
Can I go to the school and take over the gym?
It's a good crowd, but also transportation. Obviously, we're constantly expanding and improving on that.
We're now up to 8 drivers, including myself and Andrea. And we drive a lot. So I think the biggest thing with that, I know we get a lot of referrals from the clinic. We get a lot of referrals from Dr. Graham and the physical therapy and the rehab. We get tremendous referrals and we appreciate that. But a couple things that we'd like everybody to remember is that if we're transporting, and I know the hospital does a great job with it. If we're transporting somebody home from the hospital, we say, is somebody going to be there to meet them? Our insurance won't allow us to take somebody home from the hospital to an empty home. So somebody has to be there. Doesn't matter how long they're there, but when the driver delivers them, somebody has to be there. So we're working on that and expanding, and it's increased twofold probably just in the last 5 months with North Lake as well.
Jimmy, that's something I think you ought to make sure that the public knows about how important it is if they are going to have that service, and it's such an important service, have somebody available to meet the senior who's been wherever they've been coming home.
And it's not just seniors, and that's a question I probably get on a daily basis is, oh, so you drive seniors? Well, we drive anybody. We'll take anybody, public, all ages, stages, everything. But obviously the priority, if there's a medical appointment for a senior, disabled, or a veteran, that's going to take a priority over somebody going to the grocery store. We do a lot of that as well.
Thank you, we appreciate that. Paul, any last words from Kobe?
I've said enough.
Any other issues that we need to bring before our committee? Cece, I know that you brought us that great musical interlude.
All I want to say is I took the chronic pain class, and it's wonderful. Many people can really benefit from it. They have a whole new slant on chronic pain. It's not something, well, it is in your bed.
In your brain.
Yeah, in your brain.
Some people, it's just in their neck.
Some is lower.
Are there any other issues we need to bring up? If not, thank you very much for your time. We're a little bit ahead of schedule. Thank you.
Thanks. 5 minutes.